Hi, good morning, everyone. My name is Elizabeth Leone, and I am the chairperson of the New York City Local Early Intervention Coordinating Council. I'd like to welcome you all to our web-based LEICC meeting. As of May 15, 2014, the New York City's local law number 103 of 2013 and the New York State Open Meetings Law require open meetings to be both webcast and archived. This meeting is being recorded today. I will now review the procedures for the LEICC meetings. For in-person LEICC meetings, attendees should pre-register on the NYC Department of Health Early Intervention LEICC webpage. For web-based LEICC meetings, attendees will find a link on the NYC Department of Health Early Intervention LEICC webpage. Meetings are open to the public, but the audience does not address the LEICC members during the meeting. For this web-based meeting, we will not use the chat or Q&A features. For this web-based LEICC meeting, members of the public were asked to submit written public comment by emailing. Public comments will be read into the record at the end of the meeting. LEICC members will raise their hands instead of raising their cards to make comments. And LEICC members should keep their cameras on during the meeting. Transcription will be available for this meeting. Written meeting minutes will also be made available. LEICC members, would you please introduce yourselves? And we can start with Lydia.
Hello, everyone. My name is Lydia Ledniak. I'm the Assistant Commissioner for the New York City Bureau of Early Intervention. And I will pass it off to Kara.
Hi, my name is Kara Chambers, and I'm the Director of the Legal Aid Society's Education Advocacy Project.
And who would you like to kick it to for an introduction?
Oh gosh, I'll kick it to Trisha.
Good morning. My name is Trish DeVito. I'm from the New York City Department of Ed. I'm the chairperson for the Committee on Special Education, CSE2 in the Bronx. And I will kick it over to Jessica.
Thanks, Trish. Good morning, everyone. I'm Jessica Wallenstein, Senior Director for Children with Disabilities, Birth to 5, in the DOE's Division of Early Childhood. And I will kick it to Eileen.
Good morning. My name is Aileen Gonzalez. I am United for Brownsville's first early intervention ambassador. And I'll pass the mic over to David Harrington.
Good morning. I'm David Harrington, co-director for United for Brownsville. I'm not a member of the LEICC, but I am presenting today. And I'll kick it over to Nora.
So Nora is not in the room right now, and so we're only doing member introductions. I'm sorry. So just for the record, so let me drive a little bit because I know many people have joined. How about let's see, Patricia Gray, would you introduce yourself, please? Thanks.
Hi, good morning. I am Pat Gray, and I am the Director for Continuing Education at the Silberman School of Social Work, and I'm part of the academic partnership group with New York City BEI. Thank you.
Thanks. Roseanne, would you introduce yourself?
Hi, good morning. I'm Roseanne Saltzman. I'm the Program Director at Up We Grow and a member of the LEICC.
Thank you. Sonu?
Good morning, everyone. I'm Sonu Sangui. I'm the Clinical Director at Achieve Beyond.
Simone, would you introduce yourself?
Good morning, everybody. I am Simone Hawkins. I am the Assistant Commissioner for the Bureau of Child Care at the New York City Department of Health and Mental Hygiene.
Thank you. Let's see, who else are we I think that's it. I'm actually trying to retrieve Yuri Pollock, for our ACS partner, from the participant list. Aracelis, would you help me, please? Sorry, just bear with us for one moment.
Sure, give me 1 second.
Thank you.
He's having issues connecting, so let's give him a few.
Great. Okay, I think in the interest of time, we should probably keep going, and Aracelis will help Yuri out of attendee land into participant land, which if you know anything about WebEx, that is unfortunately how it works. Okay, Liz, let's continue.
Okay, so welcome all. Now we will approve the minutes from the last LEICC meeting. So will someone make a motion to approve the minutes?
I'll move to.
I
approve the
motion to
minutes.
approve the minutes.
Thank you, Roseanne. Will someone second the motion to approve the minutes?
I can second
the
it.
motion.
Thank you. Aracelis?
Yeah. So, Lydia Leniak, do you approve?
Yes, I approve.
Carol Chambers, do you approve?
Yes, I do.
Trisha DeVito, do you approve? Trisha? Okay. Patricia Gray, do you approve?
Yes.
Simone Hawkins, do you approve?
Approve.
Elizabeth Leone, do you approve?
Approved.
And Sundari Pariasamy, are you on? No. Okay. Roseanne Saltzman, do you approve?
Yes, approved.
Sonu Sangowi, do you approve?
Yes, approved.
And Jessica Wallenstein, do you approve?
Yes, approved.
Okay, and that's the end of the list.
Thank you, Aracelis. Okay, so now we're going to move on to our next item. I'd just like to say before we start that we have so much information and so many presenters that have so much good information that we need to hear. And so I want to make sure that we get everyone in on time and get everyone's questions in. So if at any time I interrupt and let you know that you have a few more minutes, please don't, take it anyway. I just want to make sure that everyone gets all their information in for today, okay? So we will start today with Lydia Legniak, and she will be presenting the SEICC report and the EI program updates.
Thank you, Liz. And again, I just want to thank everybody and welcome everybody to our summer 2021 LEICC. I don't think we've ever had this large a turnout for a summer LEICC before. And I think that could be attributed to our electronic meeting shift here, so I'm happy about that. As Liz mentioned, I'm going to be speaking with you about the State Early Intervention Coordinating Council, and I'm also going to be providing, updates about where our program stands vis-a-vis COVID-19. But before I do that, I would like to make staff announcement. I am pleased to announce that Dolores Jordanella is stepping into the role of Acting Director of New York City Regional Offices. Dolores has 25 years of early childhood experience, really specializing in early intervention. She started her career in 1996 as a service coordinator. And Dolores then joined the Bureau of Early Intervention in 2007 as an assistant director. And then in 2012, she became the regional director for the Manhattan Regional Office. Dolores will support the program in her acting role by working collaboratively with all units within the early intervention program and the provider community. While Dolores steps into the acting role of early intervention of the director of New York City Early Intervention Regional Offices, Assistant Director Yi Lang Lee will be assuming the role of acting director of the Manhattan Regional Office. Ms. Lee joined the Bureau of Early Intervention in 2010 as an EIOD, and she was then promoted in 2016 as an assistant director. So please join me in congratulating and welcoming Dolores and Ling into these really critical key roles during this important time. So with that, I am going to shift and talk to you about the SEICC. I'm going to keep things brief. These were the agenda items covered at the June 16th SEICC meeting. I have shared all of the materials with all of you that were specifically covered at that SEICC meeting. I will be really giving an update on the early intervention program regulations, as the state did issue an update at the last meeting. I'm going to be talking about the Provider Workforce Capacity Task Force, and I'm going to be talking briefly about the EI Hub implementation status. So, at the last SEICC, the State Department of Health provided additional clarification regarding the upcoming regulatory amendments specific to Section 69-4.30. Now, what I'm going to just mention in these slides are an addendum to the presentation I did on the regulations at the last LEICC meeting. So all of the other proposed changes that the state is going to pursue stand, right? And the presentation that I sent all of you includes the full list of their proposed regulatory amendments. So the reason that I'm bringing these up is because these were the ones that were amended. So just to recap, this is around billing for group early intervention services. So the proposals that they spoke about were billing for group early intervention services are up to 120 minutes per day as specified in an approved IFSP. That is the duration. Group EI service sessions will be a minimum of 60 minutes in length and a maximum of 120 minutes in length in accordance with the child's IFSP. Those are consistent with what the state presented last time. The modification was here, group size. Now they are indicating that it is 2 to 8 children. And then the use of one-to-one aids should be based on clinical appropriateness. In addition, groups provided by must be provided by a minimum of one approved and appropriately qualified early intervention provider and an assistant. And groups should consist of children with similar IFSP outcomes and include appropriate therapeutic approaches. Children participating in group EI services cannot also receive individual services, meaning push-in or pull-out services while the group is in session. SDOH did not provide a date for when this regulatory package will be posted for public comment, though we kind of expect that this will happen sometime in the fall. Okay. The SEICC also provided an update on the Workforce Capacity Task Force. To remind all of you, the goal of this task force is to develop recommendations for the State Department of Health to increase provider workforce capacity to deliver early intervention services. The charge of this group was also revised to include telehealth as a area of focus for this work group. So just to recap, the State Early Intervention Coordinating Council voted to adopt the following competencies for the delivery of evidence-based evaluations and services in the New York State Early Intervention Program. And the competencies are there in front of you. I went over them at the last meeting. And that the state is still planning on releasing a survey about telehealth to assess the impact of telehealth and the perceptions around telehealth from parents, therapists, as well as providers broadly. And they are intending to disseminate that soon. The task force agreed to also develop a companion document for the New York State Department of Health Bureau of Early Intervention competencies that will include definitions, knowledge areas, and skills for each of the competencies in order to provide academic institutions with more clarity. So this workforce has started to develop the companion document in partnership with various LEICC, so various bodies like us that exist around the state, and with local academic partners. So I think that our LEICC has been engaged in that, particularly our own academic partners, and so we are happy to continue to work on these areas and to provide the state with input on the companion document. So now moving over to the EI Hub implementation, just backing up for everyone, the EI Hub is supposed to replace the New York State Early Intervention System, which is the state's case management system for EI, which we call NYCE. The state has launched the EI Hub Learning Management System in April 2021. Everybody, all providers are encouraged to set up an account in the learning management system and navigate around and take whatever modules are in there to sort of orient themselves as to what the hub sort of looks and feels like. Once the hub is implemented, NYCE will move to a read-only status approximately 2 weeks prior to EI Hub go-live date. We have been, as a city, working with the state to really understand what that is going to mean for our operations. Because if we have no system for a 2-week period, as many of you who operate programs and understand, that is going to cause some impact in the way that we do business. So we are planning now to ensure that there is no interruption. NYCE will likely be retired approximately 2 to 3 months after being moved to a read-only status, meaning after the implementation of the hub, NYCE will continue to be out there for 2 to 3 months if anybody needs any other attachments or anything else, because then it's going to be retired, meaning nobody's going to be able to access it again. So we in New York City are taking that cutoff very seriously to ensure that we have all of, that we're going back and ensuring that all of our records are sort of in place. Now, the EI Hub go-live date, I reported to you last time that the state was intending to launch the EI Hub in May 2021, which the timeline for that has passed. So the implementation has been delayed from May 2021 until mid-2022. And I personally am happy that we're seeing this pushback because, I think, with COVID, we really need to wait until the system is more stabilized until we are more all back in the office and sort of can take on things like in-person training and doing things that require more face-to-face interaction. And that is my update from the SEICC. Does anybody have any questions that they would like to raise? Kara, please.
Hi, I just had one question about the proposed regulations, and I may have mentioned this at the last meeting, so I'm sorry if I'm repeating myself again. But I did want to have some concerns about the proposed regulations stating that supplemental evaluations have to be authorized in the IFSP, because I'm concerned that it will result in delays in getting those supplemental evaluations done. If service coordinators are under the impression that they have to wait until the 6-month IFSP meeting in order to approve those supplemental evals, even though a need for a supplemental eval might be identified months earlier, that's going to be problematic. So I do want to make sure that that the plan is, and that service coordinators are told that they can hold IFSP meetings prior to that 6-month, the regular 6-month review date, so that those supplemental evals can be done in a timely manner.
I think, your point is well taken. I think the clarification that I'd like to add is that currently before, when basically after eligibility is established and after we have that initial IFSP, the system now requires that there is an approval for a supplemental before it happens. So, but that's after eligibility is established. Your point is well placed because it is a concern for before, right? So many times a child may need a supplemental or may get a supplemental as part of establishing eligibility. Now, with this modification, it will mean that eligibility will have to be fully established as part of what we now term as the core. So it's the general developmentalist and one professional in the family's area of interest. So yes, I think that we as a system will have to really think about how we implement that in order to ensure that there is minimal disruption. Anyone else want to, oh, Yuri has joined us. Yuri, would you like to introduce yourself?
Sure, thanks so much. Sorry for the technical difficulties all. My name's Yuri Pollock. I'm an associate commissioner at the Administration for Children's Services. Great to be here. Thank you so much, Lydia.
Thank you. Happy, WebEx is very difficult in terms of technology. And
it is. It would not let me join.
Yes. All right, great. Okay, I will go on now with early intervention program updates. Okay. So just recap where we are, where we're going, where we've been. In March 2020, New York State deemed us, EI, as an essential service during New York on pause. On March 24th, we shifted all of our services to teletherapy exclusively. On June 22nd, we released guidance of how we're going to resume in-person services, stressing full flexibility wherever possible between in-person service delivery and teletherapy when it was appropriate or needed. On July 6th, in-person home and community-based services, individual facility-based services, and evaluations started to be delivered in person. And in October 21st, 2020, early intervention group services resumed with multiple transportation options. Now, resuming in-person services, early intervention therapists and teachers were eligible for COVID-19 vaccines as of January 14th, 2021. Currently, all early intervention services are available utilizing teletherapy and in-person services, with some services only available in person. In order to support resuming in-person services, we implemented a COVID-19 case reporting protocol, which outlines what providers must do if there is a confirmed case of COVID-19 in the home, group, or community-based setting. And working together with providers as well as within our own department, we were able to intervene on approximately 200 confirmed COVID-19 cases by adjusting service delivery based on individual family and child needs. The majority of those cases were actually home-based cases. They were not in the center, though we did have some centers that needed to close. And so we worked very well and very collaboratively, and what I think very quickly, to resolve and act on those issues. Okay, now latest COVID updates. On June 23rd, just a couple days ago, the governor announced that all executive orders related to COVID-19 have ended effective June 24th. Now, what does that mean for EI? So all previous early intervention guidance related to COVID-19 remains temporarily in effect, including the provision of teletherapy as applicable. Once the Department of Health issues guidance, we will follow up that guidance with detailed implementation protocols and expectations so that we can be as nimble as possible in continuing to move our system through this pandemic and out of it. So that is where we are. I'll stop for any questions. Okay. Doesn't look like there are any questions.
No.
Okay.
Okay, we'll move on to Nora Puffett, who's Director of Administration and Data Management, and she'll be reporting on a data report and provider oversight activities. Nora, I think you're muted.
Good morning, apologies. So today's the last year of the fiscal year, and here we have the last 3 fiscal years to take a look at and see where we've come. As you know, our goal at this point is really to get back to FY19 levels, which actually were the highest they've been in a few years. And you can see that sort of by the end of April and May here, we were starting to get there. We're looking pretty good. When we look at referrals more generally here, and I apologize, my tech skills are really limited. We're looking at it just in our more traditional way. You can see that with 1 month to go on this data for a full year, we're gonna be about where we were, a little higher than last year. Keeping in mind that 2021 fiscal year means July through December of 2020. So this is very much a year that still contains a lot of the pandemic with us. This is not our post-pandemic yet. You can see here, interestingly, the only slight change here is a very slight drop in Manhattan, which I think is consistent with other things we've heard about the population during COVID. And what you can see here that's very interesting is that there was no disproportionate impact by race and ethnicity on referrals, completely consistent with previous years. In terms of services, this is more abbreviated data. We have to leave a few months to report on services. So this is only through February. So it's hard to say at this point, but my guess is it'll be about on par with last year. And again, there was not a disproportionate effect in terms of race and ethnicity. This is the waterfall. So to remind you, this takes the cohort of children who aged out during that year and says, what happened? Did they make it to evaluation? Were they found eligible? Did they get services? And what we see here is really the only possible proportional impact here, a little bit different, is that Asian children getting to eligible and services looked a little bit lower than previous years. And there really wasn't much difference across other groups. And then my insurance status slide, which I always have to put in, I know you love it, which is main issue telling us about both how many of our children have Medicaid, which is 63 plus another 3% having both Medicaid and private, but that another 9% are recorded as not having insurance, which is probably not the case, but rather that it was not recorded for them. And just something we like to keep in mind when we think about sustaining the system. So I'm going to pause there and ask if there are questions about the data report. Okay. So I'm going to shift now and talk about provider oversight. So last meeting, I talked about the main things we had done during this pandemic period. So up front, we called just a tremendous number, more than 9,000 families, to find out about what was going on with services. And then following that, we've been doing some note reviews, the final results of which we're actually sending out to providers right now. But what we've also already started on is annual monitoring, and we're going to get back to it. We're going to do every agency this year by the end of 2021. It's remote. They are sending in their materials electronically, and we're reviewing them here. We are focusing on all of 2020, but especially the pandemic period, and we're focusing on ongoing service coordination and service provision, because probably our biggest concern about provider performance during COVID was, did they stay in touch with their families? Did they make sure their families transitioned to teletherapy? You know, did they address any challenges they had there? So that's really going to be the feedback, but it is going to be feedback. It will not be our traditional audit report with ratings. It's going to be more of a letter of advisement saying, these are what we saw. We're also going to complement it with a second piece that we have not done before, which is an administrative review. And they're going to be done separately. So more toward the second half of the year, probably, people will be getting requests asking for things like their policies and procedures, their personnel manuals, and we'll be giving feedback on that as well. Again, not a rating, but you know, you should really consider adding these things or looking at these, or we noticed that this was contradictory. And hopefully, we hope that will be helpful. This is new for us, so we're very curious to see how it works and what people think. And does anyone have any questions about any of that? Yes.
Nora, this is Kara. I have a quick question. I'm wondering whether during the pandemic you saw any increase in the number of requests for mediations or partial hearings, because that is also a measure of satisfaction and performance by the agencies.
That's interesting. That's not something I actually am involved in, so I would defer to Lydia on that later, because I honestly don't know.
Okay, thanks.
Okay, thank you.
Thank you, Nora.
I think the answer to your question is actually we did not see an increase in impartial hearings. Certainly not in impartial hearings, actually. Mediations, I would have to check that data, but I think we could let you know sort of, we can dig into that a little bit and tell you at the next LEICC meeting sort of what happens about it. I will say in a year we get less than, I mean, I don't want to be too conservative, but I think we get less than 50 mediation requests. We try to resolve issues before they have to get to that level. We don't like to do that. We think that it's, you know, it's tough. I mean, if we have to, we will, if there's really an impasse, but in most cases we can come to an agreement with families before it has to get to that. Okay, let's see. Okay, Liz.
Okay, great. So now we will hear from Catherine Canary, our medical director, and she'll be presenting on COVID-19 vaccine updates on H&H referral and bidirectional communication project.
Thanks, Liz. So I'm just going to talk for a couple of minutes about COVID vaccines, which, as you all well know, there are 3 that have an emergency use authorization. The 2 mRNA or messenger RNA vaccines, which are Pfizer and Moderna, and the 1 adenovirus vector vaccine, Johnson & Johnson or Janssen. Everyone 12 and older can now be vaccinated, although only the Pfizer is authorized for kids 12 to 17. Anybody over the age of 18 can be vaccinated with any of these three vaccines. You also know from the news that the COVID-19 virus, SARS-CoV-2, mutates regularly, especially as there continues to be virus transmission between people. So variants, or basically changes in the genetic structure of the virus, are expected. At the present time, there are actually 4 notable variants or variants of concern that the CDC notes on its site. And I realize that's a change from the slide, but that's just sort of a, just re-emphasizes the fact that the data and the numbers are changing all the time. And so, what anybody can tell you about these is different from day to day. So far, the studies suggest that the currently authorized vaccines work well on the circulating variants, but obviously that's under continued study. The good news about COVID vaccine doses in New York City is that, as I said, all New Yorkers over 12 and over are eligible for vaccine. And as of today, more than 9.25 million doses have been given to New York City residents. And in fact, these numbers are slightly better. 51% of all New Yorkers are fully vaccinated, and 56% have received at least 1 dose of one of the vaccines. So what does that mean? It means that COVID is not yet a thing of the past. The best thing you can do to protect yourself and your loved ones, your colleagues, everybody around you, is to get vaccinated if you can. The person vaccinated isn't the only one who is protected by vaccine. It also protects people around you who may not be able to be vaccinated, like kids under the age of 12 or people with medical conditions that might be a contraindication to them getting the vaccine. If you're not fully vaccinated, or which means either that you haven't received a COVID vaccine or that you're not 2 weeks out from your either second dose of a 2-dose series or your single dose of Johnson & Johnson. So if you're not fully vaccinated or vaccinated, you should still wear a mask that covers your nose and mouth. Stay 6 feet apart from others who don't live with you. Avoid crowds in poorly ventilated indoor spaces, and wash your hands often with soap and water. And use hand sanitizer if those aren't available. Any questions about any of that? Okay, so let me just move on to just an update on our the project that we've been involved in with health and hospitals to improve referrals and bidirectional communication. Now, I'm obviously not Dr. McCord. She was unable to be with us today, so I'm presenting in her stead, although I'm actively involved in this project as well, but she knows the H&H side of it better than I do. As you know from previous LEICC meetings and presentations, New York City Health and Hospitals obtained funding to address developmental screening in their primary care sites. And part of that funding went to developing a direct referral process to early intervention using their electronic health record, which is called EPIC. The referral process has started as a pilot at Bellevue, Gouverneur, and Queens Hospital Center, and we anticipate that it's going to continue to roll out to some of the other sites. Some of the ones that we're anticipating will roll out soonest may be Kings County, Harlem Hospital, and Jacoby. As you remember, there are a couple of important goals of this project. One is to facilitate referrals to early intervention. So rather than the clinician having to either send a fax to EI at the end of their clinic shift, or giving the parent the EI number and telling the parent to call and make a referral, this way the primary care provider can click a few buttons in the electronic health record and get the referral process started. Another important goal is to encourage information sharing between early intervention and H&H by having the parent sign a consent for this information sharing at the time of the referral. So we think this will help with retention in the program so that we can, because we'll have this ability to share information back and forth, EI can identify promptly where kids are in the process and can let H&H know if there's been a drop-off, and then the primary care provider can follow up with the family, you know, in a timely way rather than wait a couple of months till the kid shows up again in the clinic and they talk directly to the parent. Also, this lets H&H sort of keep track of their own providers within a clinic site to see who's using this referral process, who may not be, and if they want to do some internal QA or additional training or whatever to keep everybody on board and enthusiastic about the process, which so far we've heard that folks are. Apart from the development of the referral form and the referral and consent process, we've made, you know, a fair amount of progress to date. We've continued to have monthly conference calls between BEI and H&H. And as far as the information exchange process, we have data from April and May indicates that 100 children were referred using this EPIC electronic health record mechanism, and 63 of those indicated that parents had signed consent to share information between H&H and early intervention. So, yeah, it's about 2/3. So I asked Mary, you know, what she thought the 37 who didn't get consent, you know, what that could be attributed to. She said that she thought it was a combination of either the healthcare provider just forgetting to click the button in the EHR where it says consent was obtained, or they may have just failed to obtain the consent, because our understanding is that this sort of consent process is pretty different from what H&H does in other contexts when they need to obtain consent. So it's sort of a switch in thinking for the primary care providers. So the next version of the this referral form is almost complete, and it'll be rolled out across H&H very soon. Any questions about that? Great, thank you.
Thank you, Catherine. So now we're going to hear from Jeanette Gong, who is Director of Intervention Quality Initiatives on ACS initiatives.
Good morning, everyone. Next slide, please. So the process for completing evaluations for children in foster care involves additional procedural steps for service coordinators and evaluation providers. Success for this population requires ongoing and close collaboration with foster care agencies. In order to support this population, New York City Early Intervention and ACS developed a data exchange and implemented monthly data reports in 2018 to share information with ACS and foster care agencies on the status of each child in the EI program. Next slide, please. Since the start of Improved Information Sharing Initiative, communication has greatly improved between systems. However, foster care agency staff, legal service organizations, EI providers, and EI staff continue to report communication gaps and delays in evaluation among the foster care population. In order to better understand and address the drivers of this delay, New York City Early Intervention and ACS are planning revisions to the New York City Early Intervention Surrogacy Chapter, focus groups to better understand the drivers of delay and plan for long-term interventions, and training on surrogacy and parental rights for EI providers. Next slide, please. New York City BEI and ACS plan to hold focus groups in fiscal year 2022 with ACS caseworkers, educational specialists and supervisors, foster care parents, and parents of children in foster care. New York City BEI is currently developing the facilitated guides for each of the focus groups. This will include the questions and the screening criteria for all participants. These questions and screening criteria will be reviewed by ACS, members of the LEICC, and key advocacy groups prior to the launch of the focus groups. BEI and ACS are currently also developing plans to recruit caseworkers, educational specialists, supervisors, foster care parents, and parents of children in foster care to participate in these focus groups. Next slide, please. The focus groups will be performed by a consultant. Each participant will receive a gift card for their participation. The consultant would summarize the information gathered from the different focus groups, and the results will be shared with the LEICC, and the information will be used to inform current and future initiatives to improve the timeliness and EI participation. Are there any questions? Next slide, please.
Just like to add a very, very quick note. Jeanette, thanks so much for that. This is just not to toot our own horns or anything like that, but I think that this presentation just highlights the very strong collaboration and partnership that ACS and BEI have had over the past several years. Lydia and I were talking about this the other day, and really both the number of children in foster care that are referred to EI and the number of evaluations that have been done have risen significantly over the past several years. But we, of course, if the number is not close to 100, if the number is not 100%, we want to get it as close as possible to 100%, and it's not 100% yet. So the consent to evaluations is especially something that we want to focus on. And ACS is very, very pleased that DOHMH is, able to, both provide funding for this, which is very, very generous, and DOHMH's support as well. We anticipate partnering together, doing a lot of work to identify, make sure we have proper representation in these focus groups. Some areas or some techniques that we have in mind are we have a very valued Parent Advisory Council, or PAC, at ACS. We'll be utilizing them. We have very close partnerships with our foster care agencies, and we're actually re-RFPing the entire foster care system this year. So there's a renewed emphasis on kind of what new things foster care agencies can do to engage staff, foster parents, and parents as well. So we will be identifying foster parents, and staff through our foster care agencies also. And it's important to note the hiring of a consultant is a key here. There's a certain art to doing focus groups, making sure representation across all areas is very robust. There's a very diverse fabric of foster families in New York City. We want to make sure that's adequately represented here. So the consultant will make sure that we do that we are on point there. So thank you so much.
Okay, thank you.
I would just, I guess what I would just briefly want to add that, I think it's going to be really important to make sure that both the screening criteria as well as the facilitator's guide have broad input from not only agency partners, but also from other organizations that work with foster parents, parents of children in foster care, as well as just broad advocacy groups. And so we're going to be very shortly beginning that outreach, because we want to make sure that we are asking and probing the right areas, but also doing it in a way and advising our consultant and our, basically their focus group firm about what the right approach is, what they need to say up front, in order to ensure that people feel like they can share this information and everything will be kept anonymous, and not really affect them, personally in any way. So we are sensitive to the fact that we are two huge bureaucracies, and we need to kind of let people do it who know how to do it and can do it in a way that is not threatening to participants, as I sit here in front of you wearing a mask. So Anyway, I just felt like I wanted to get that out there. So I don't know if anybody wants to add anything or ask any questions about this before we move along. All right. Doesn't seem like
Okay.
it. Okay, it is.
All right. So now we will hear from David Harrington, who is co-director of United for Brownsville, and Aileen Gonzalez, who is the early intervention ambassador for United for Brownsville. And they will present on the United for Brownsville project update. And I'm very excited to hear about this one.
Thank you, and good morning, everyone. I'm David Harrington, co-director for United for Brownsville. And please advance to the next slide. So United for Brownsville has spoken at LEICC meetings before, but I do want to give a little reintroduction because it's been a while. In Brownsville, Brooklyn is a neighborhood in central Brooklyn. On the top left, it's there in red. That also has the nation's highest concentration of public housing. But I think one of the things that really defines the neighborhood is the activism and commitment of local residents to their community, which you can see reflected a little bit in the photos at the bottom of this slide. On the left, we have some of the United for Brownsville staff and many of the mothers, fathers, and grandparents and their children who are on United for Brownsville's Family Advisory Board, which is a group of local leaders who drive United for Brownsville's work and set our priorities. And then on the right at the bottom, you have a shot of one of our provider action team meetings. And that's the other stakeholder group that helps drive our work. It consists of a really diverse array of social service, health services, and educational services providers who agree to collaborate with local families in the spirit of racial equity to improve outcomes for children in the community. And those two groups are really at the core of United for Brownsville's work. But I should mention that United for Brownsville is not its own organization. We're a collaboration between two larger nonprofits, SCO Family of Services and Community Solutions, both of which have been in Brownsville for, in the case of SCO, many decades, serving families there in a variety of capacities, and Community Solutions has been there for over a decade. Next slide, please. And this slide really illustrates how United for Brownsville works. So again, we're a collaborative of families and professionals who develop hyper-local, innovative, measurable solutions to inequities found within systems serving children aged 0 to 3 in the community. And this shows a little bit of our structure. So Aileen and I are members of United for Brownsville's backbone staff, which is in yellow at the bottom of our screen. But as I said, the decision-making and setting of priorities and goals and values for us really comes from the Family Advisory Board and the Provider Action Team, who are in the center left, and with the Family Advisory Board taking the lead there. And we're also advised by a leadership council, which consists of executives from city agencies and nonprofits and businesses in the early childhood space, which Lydia is a member of, as well as Dr. Daniel Stevens. And then for everything that we do, we rely on a lot of guidance from our backbone organizations, Community Solutions, and SCO Family Services, and external partners and advisors. Next slide, please. I think the early intervention work that we've done really exemplifies how United for Brownsville works, but also how we hope to work more in the future. United for Brownsville was founded in 2018, so we're about 3.5 years old now. And the early intervention work we've done is really the first example of process-focused, data-driven, resident-led racial equity work with a potential to impact entire systems that serve the community. And it started back about 3 years ago in the summer, in early fall of 2018, when we were first setting priorities and heard from families that often there was difficulty referring children to early intervention in Brownsville and getting them through the process. And some of the members of the Family Advisory Board had raised children in more than one neighborhood and had noticed that it seemed to be different in Brownsville. That it was harder for their children to get through and access the services that they needed. And the service providers who worked with us concurred with that. They thought what families were saying seemed to be true, but they didn't have neighborhood-wide or comparative data to help them understand the problem. Next slide, please. But the work really changed when we began to form a relationship with the Bureau of Early Intervention. And I have to give a lot of credit to the Bureau of Early Intervention. You have been really terrific partners with us in this work. And having worked at city agencies before, I know that type of engagement can really be difficult for city agencies to do. But the Bureau of Early Intervention has approached this work with us in a spirit of openness and collaboration, and really demonstrating a commitment to racial equity. And early on shared with United for Brownsville zip code level data that identified clear racial inequities in the early intervention enrollment process in Brownsville compared to city-wide rates, particularly for Black children in Brownsville. And in looking at that data with the Family Advisory Board and the Provider Action Team, we were able to identify barriers in developmental screenings, in referrals, and evaluations, and family engagement and trust building that potentially United for Brownsville with our local collaborations could break those barriers down. And that's what we've been pursuing since about 2019 collaboratively. Next slide, please. And can you skip to the next slide also? So this data is showing early intervention referral rates citywide and in Brownsville by race from 2016 to the first quarter of 2021. And I think what's really notable here is that when we began talking about early intervention with local stakeholders in 2018, the dark blue line, which represents Black children in Brownsville being referred to early intervention, that line had always been lower than the Black citywide rate, which is the lighter blue line, and had been lower for the baseline for children of all races in New York City, and much, much lower than the New York City white rate. So the pipeline into early intervention in Brownsville was particularly not working for young Black children in Brownsville. And just in the first year of working together with our local stakeholders and sharing the data we've received from the Bureau of Early Intervention and thinking it through and doing some problem solving, including things like looking at our providers' referral processes and looking for ways to improve those processes, move things around, add steps. It seems that we were able to impact the rate of referral for Black children in Brownsville, so that for the first time in the data we'd seen, that referral rate for Black children climbed above the rate for Black children citywide and got closer to the baseline rate of children of all races in New York City and closer to the white rate we'd ever seen. And as we all know, 2020 is a really hard year to understand, but it is interesting to us, although we don't have a good explanation for it, that in 2020, the Black rate of referral in Brownsville was higher than the other rates that we've been tracking. But what we do hope to see this year in 2021 is a continuation of the success we saw in 2019, increasing Black referrals, although we know that that hasn't yet translated into increased retention in the enrollment process for receipt of services, which is what we ultimately want to impact. So we've run the pipeline of children into early intervention, but haven't later down the line made improvements yet. Next slide, please. But using the data we have from BEI, we can be really targeted in thinking about ways to impact the evaluation rates for Black and Hispanic children in Brownsville, which are lower than citywide rates, and then also impact and reduce that drop off between eligibility and receiving services for Black children in Brownsville. And the keys for this that we've heard are it really comes down to establishing trust and offering high quality assistance to both social service providers and families who are navigating what can be a complex and confusing and emotional process for everyone involved. And we know in the case of service providers, many just don't have the resources and the time to dedicate to families to help them navigate that process, which led us to conceiving of a role called an early intervention ambassador, which came about independently through conversations with the Family Advisory Board, the Provider Action Team, and even from the Bureau of Early Intervention, that we were not able to hire for in 2019, in 2020, but were able to hire in 2021 to really focus on increasing retention. And with that, I'll introduce it. I'll pass it over to Aileen Gonzalez, who is the first early intervention ambassador for Brownsville and we think anywhere. And she can talk about what she's doing to really drive up the retention rates of children in the enrollment process.
Thank you, David, for the warm introduction. You could advance to the next slide, please. Good morning, everyone. I'm United for Brownsville's first early intervention ambassador. I support any family with infants and toddlers from Brownsville who could benefit from receiving early intervention services. As David mentioned, to carry this out, I have to be a liaison and foster trust with parents and service providers. In terms of our goal is to increase referral rates, evaluation rates, and receipt of services for Black and Latinx children, and really changing the existing early intervention referral process in Brownsville. For providers, I anticipate roadblocks and pain points for the person referring to early intervention and making sure that their client is successful in every stage of the referral process, from the inception of talking about a developmental delay or concern to at the end state of receipt, or what happens after the child is found not eligible or eligible for the early intervention program. For families, I provide information, resources, and support through the entire stage of the referral process and offer developmental screenings using the ages and stages questionnaires and support any transitions either exiting the EI program into the Committee on Preschool Special Education or to daycare settings or Head Start programs. So essentially, like on the surface, I described as the EI ambassador role as sort of being a human services role where it's straightforward with providing services, but really like my day-to-day responsibility is meeting the needs of the entire family and addressing basic needs first before they could engage with the early intervention program and be successful in addressing developmental delays. Next slide, please. And all of my work wouldn't have been possible had there not been collaborations with the Bureau of Early Intervention. And I shout out specifically Ms. Jeanette, who has been instrumental in meeting with me bi-weekly to talk about some of the processes and experiences that she has in her history at the Bureau of Early Intervention. And that has helped inform my work and my approaches to families and providers. To this day, we've hosted 5 community-wide early intervention research table talks because we were trying to reach families wide and far in the Brownsville community to begin talking about early intervention and what developmental delays may mean and what that means for the young children. We've also introduced a community-wide 7-week virtual event titled Lunch and Learn with Early Intervention Ambassador, and that happened every Wednesday at noon, specific to the families at the Grand Wyndham Agency, the foster care agency, who families didn't know that early intervention even applied to them or that it was a service that they needed. And so these experiences, although we're targeting families, we're targeting their friends and their relatives and people they know that maybe aren't at the virtual events, but they know that the support is available and free for the Brownsville community. We've presented up to this date to over 80 community-based organization staff who provide service, who work or live in Brownsville, Brooklyn, who could talk to a family about an EI ambassador who's in the community, who they've vetted before, and who is really a partner with the families in Brownsville, Brooklyn. What's cool about my role is that I don't necessarily work with an early intervention agency, hospital, or school. So I'm in a position to foster trust and really praise the parents for the strengths and some of the areas of growth and set them up for success. And I think that's everyone's goal in this meeting. To this day, we also host recruitment events with family advisory board members and engaging families in the community about early intervention. And now that the weather's getting hot, there's kids in the park, there's caregivers in the park, and they've been very excited to talk about early intervention and really are interested in what we have to say about development. And they're always willing to learn. And sometimes they don't know what they don't know, right? And part of it is bringing that information to them in layman terms and coming from an area of strength and celebrating them for being parents. Next slide, please. Our recent work, I am supporting 16 families pursuing evaluations, 9 families in early intervention and 7 in the Committee on Preschool Special Education, with the help of service providers in the community. We are working with 7 families who are participating in a developmental monitoring service, and we're talking about development weekly or bi-weekly that's specific to the young child and their abilities. And we're also partnering with many of these agencies listed here, the Bureau of Early Intervention, and we've made special inroads with Brookdale Hospital Medical Center at Healthy Steps and the BMS Family and Health and Wellness Centers, who are referring families to me who they want to see successful, who they know they have developmental delays and need support services that I'm guaranteeing that their young children that they're serving will get those supports. These agencies listed, like Up We Grow, New York Center for Infants and Toddlers, have been instrumental in providing evaluations that are responsive, that are readily available for our families in Brownsville. So we've got nothing but success and great news to report back today. Next slide, please. We've also launched what we call the socialization room. Before we used to call it the evaluation station, where providers could come to the Gregory Jackson Center at the heart of Brownsville to do evaluations, to do tele-evaluations with families who maybe they're not comfortable going into the family's home, or families are not comfortable hosting evaluations in their home. They could come to the Gregory Jackson Center, that resembles sort of a playroom and a living room for families. And we've serviced over 10 families who come to the Gregory Jackson Center either weekly or bi-weekly. They love the free toys. Everything's brand new and clean and safe for our young kids. And really what we're trying to do is address any provider shortage and provide incentive to providers to come into Brownsville to do evaluations, say do 2 to 3 evaluations at this location. Parking is pretty reasonable, so that's no longer an excuse for providers to avoid, but it's really an awesome setup for families to come and participate. We also do Zoom sort of teletherapy engagement with families, where we're coaching families how to engage with their young kids, how to promote physical development and language via Zoom. And we've gotten great success, and we hope to continue to promote the EI ambassador work and this type of project with Brownsville residents or any family living in Central Brooklyn. Thank you. Next slide, please. Please reach out if you have any questions. I'm more than willing to support and answer any of your questions.
Elena, I wondered if you could share if an early intervention provider is interested in doing an evaluation at the socialization room or delivering services there. What should be the steps? What do they need to do?
They would have to contact me directly if the family is not in my caseload, so I could set the socialization room up. It's in a shared space, so I do set it up and unassemble it, but it's available 6 days a week from Mondays to Saturday for any provider who is doing an evaluation in Brownsville. Could reach out to me and say, hey, can we use your station? That's totally possible. So it's really a community-wide access, and we're trying to reach any EI provider, any family receiving services in EI to use up the space. Even though they're not working directly with me, it's definitely available for any EI or CPSC family.
Great. Roseanne, I was wondering if you can, since you're one of the partners, I was wondering if you can reflect on your experience here for other folks that are sort of watching and potentially considering reaching out to Aileen and United for Brownsville to formalize a collaboration.
Roseanne, I think you're muted. Hi. No, we still can't hear you.
Okay, I think I'm unmuted now. Yes? Okay.
Yeah.
All right. Thank you. Thanks. It was a lovely presentation, and I've had, really very nice experiences with United for Brownsville, and particularly with Aileen in, helping to encourage people to follow up and to alleviate some of the little roadblocks that, sometimes occur between families and service coordinators. We haven't done a whole lot, and I am interested in hearing about your socialization room. That is an interesting thing. But we have done some evaluations, and really with Eileen's help to guide families through all of this and just keep them going through the process, because as we all know, listen, the early intervention process is many steps. And sometimes service coordinators might get frustrated, the family doesn't call them back, or, whatever the situation is. So just having a bunch of people and Eileen's help in all of this really has made the process just a really good one, I think, for the families that we've encountered, so far. And, of course, we do our evaluations as quickly as possible. Eileen was able to meet with some of our evaluators as well early on in the process, just to understand a little bit more about what we're doing. So it's just been a great experience of collaborating and working together to really improve the services and the evaluations in this community.
Thank you, Roseanne. I echo that.
Any other questions for David or Aileen? I think that I just kind of want to reflect one more thing, and that is, the issue of trust in these service systems like EI, like education system, and the fact that that is such a driver, and that is why the partnership with United for Brownsville has been so meaningful and the data really speak for themselves, right? Even at the height of the pandemic, and David says, oh, I don't know why that happened. I don't know why it didn't fall more. And I just think it's because you set that groundwork of trust and you started engaging the community and talking with them. And that made people less scared, because that's really what we're attributing here. It's fear, right? People were less scared and they were more trusting of the fact that this program continued to be available to them and was available to serve them. And so I think that that just speaks volumes to the full potential of this work if it could be scaled further potentially. So yeah, thank you for this presentation. Really wonderful.
Thank you, Lydia, for having us.
Thank you. Thank you for all your collaboration and trust building with the community and other local stakeholders.
Thank you, guys. And I just want to say my little piece before, because I know the time, but I just wanted to say that I am so happy to hear. One of the things that I was really taken by was the fact that you had a family advisory board, and having families have a voice in making decisions with all the other entities. I love that, and that it kind of gave me goosebumps, because I was like, I'm so happy to see that people out there who may not understand, but they're part of a family. They understand the fears, the trust, the love, the caring that goes into these children, and they bring forth that part of it. So thank you for that. The table talk, I think, is amazing. Eileen, that is such good work. And I feel like your position right now, I think, is a position that will follow through with retention. And so amazing work. I love it. And that's all I'm going to say. Okay.
Thank you, Elizabeth.
No problem. All right. So now we're going to move on to Jacqueline Shannon, who is Associate Professor of the Department of Early Childhood Education at Brooklyn College, and Karen McFadden, who is the Assistant Professor in the Department of Early Childhood Education at Brooklyn College. They will be presenting on the Inclusive and Family-Centered Infant Toddler Care Research Project results.
Thank you so much, Liz. Okay. People can hear me okay? Okay. Hi, I'm so happy to talk with everybody today, and really trying to come after United for Brownsville, because I think you'll see that a lot of the points that they are addressing are things that we heard people talk about in our research. So it's so exciting that we're actually going to talk about sort of what people told us about barriers to access and referrals, and you guys are doing that work now, so it's very exciting. So I'm talking to you today about our study we presented at LEICC when we were in the proposal phase, and so the pandemic happened, but we still sort of soldiered on and were able to collect some data. And I'm going to talk to you today about our findings from the Inclusive and Family-Centered Infant Toddler Care research project. And I wanted to start with the framing for this project, which was designed to provide information on current practices related to early intervention in the early care and education, or the ECE context. Specifically, we identified that there was a need to understand educator perceptions of EI services and child development more generally, of perceived barriers to access and referral to EI, and of the nature and delivery of EI services to children and families who are eligible. Next slide, please. And so the study specifically aimed to address disparities in referrals and access to EI services within New York City's Black and Afro-Caribbean communities. And we used mixed methods to examine ECE providers' knowledge, beliefs, and practices related to EI and child development, their perceptions of barriers and opportunities to access of EI services, their experiences with children with disabilities, their families, and EI providers, and their identified areas of need to help them support inclusion in their classrooms and strengthen their work with families. Next slide, please. So in collaboration with our partners at BEI, we identified neighborhoods in Brooklyn where EI referral rates were low. Specifically, we targeted Brownsville, Bedford-Stuyvesant, and Flatbush, East Flatbush. We interviewed 40 early care and education providers and leaders, such as directors or ed directors, including both family child care settings and center-based settings. And all the providers in the study that we're presenting to you today were in settings that served at least 50% Black children and families, and 71% of our participants were in settings that served 80% or more Black children and families. Next slide, please. This is a breakdown of our participants, so the caregivers, of which more than half of our sample identified as Caribbean or West Indian, and another large percentage as African American. And then we had a smaller sample of East Asian and Southeast Asian participants, and a tiny sliver of white. Next slide, please. In terms of our methods, we used a quantitative survey gathering educators' demographic and professional background, as well as their EI-related knowledge on family-centered practice and inclusion. And we also conducted semi-structured qualitative interviews, both in focus groups and individually, and these were about 30 to 45 minutes. These qualitative interviews were audio recorded and transcribed verbatim for our data, and participants received a $50 gift card to an online teacher supply store for their classroom. Next slide, please, for their time. In terms of our findings, our data shows that ECE providers have important foundational knowledge of EI. They understand the benefits of children's engagement with EI. We really overwhelmingly positive support of the program by all of the people that we spoke with. They know that EI services are for children with delays or disabilities from birth to 3 years of age. They know that families play a primary role in agreeing to services, and they know that services are provided free of charge. Next slide, please. However, our data also demonstrated that there's limited knowledge of early childhood inclusion and or practices among ECE educators. As for example, the majority of our participants incorrectly endorsed the concept that the brain's capacity for age increases with age instead of decreases, and didn't identify that EI services delivered to children isolated and separated from the child care teacher and the child's peers during the program's routine activities would no longer constitute a natural environment, child's natural environment. Next slide, please. In terms of barriers to access and referrals, ECE educators identified a number of system barriers that in one way or another demonstrated a lack of communication. So from the start of the referral process all the way through implementation, that there was some lack of communication between EI services, EI providers and their child care programs, including limited understanding of services, no carryover from home to child care setting, and lack of communication when services are being delivered in EC settings themselves. Next slide, please. ECE providers also talked to us about what they identified as a number of family level barriers to access and referrals. So, kind of things that were talked about in the last presentation that United for Brownsville is figuring out how to overcome, but that there remains a fear of stigmatization amongst parents and families, and being stuck with a label that this would stay with children. And then there's also an issue that they identified about conflicting views among family members on whether children need or can actually benefit from EI services that often cause a breakdown in the process when maybe mother agrees, but maybe father or grandmother thinks differently. And so that becomes a barrier. Next slide. Jacqueline,
Great.
do you want to?
Yeah, no, it's wonderful to be back and to see the amazing progress that's happening in the deep connections that you're doing at EI and UB. It's really wonderful to be back. So let me get on to this though. So our qualitative data also revealed that many of the EC providers viewed that their cultural backgrounds that they shared with families was really a strength and helped facilitate their discussions with parents when having these challenging conversations about their children and whether their children were at risk for developmental delays or disabilities. Next slide, please. However, they also recognized their need for guidance on how to support parents in the EI process and expressed a desire for educational opportunities that could prepare them to have challenging conversations with the parents, and that they recognized that that their children might need with EI. So really needing some support in that area. Next slide. They further identified the need for parents to receive education in child development, and through that from both experts as well as administrators in their own centers, to help parents better understand child development and how to best support their children overall. EC providers suggested that embedding this information on EI and child care orientation sessions, parent handbooks, and other materials shared with families at the beginning of the year, so that the idea of early intervention doesn't just come as a surprise when their children are identified as having risk or delays and needing for further evaluation. So it's not, so there's already an understanding of this being an inclusive way, and how do we build on strengths. Next slide. The EC providers also identified that some possible opportunities for overcoming the barriers of access to EI and for improving inclusion practices in EC settings. This included the need to better train early childhood educators in early childhood special education through both college level courses as well as professional development and coaching opportunities. So they themselves wanted to improve their knowledge in these areas. Next. Participants acknowledge that their own lack of knowledge of typical atypical development, of how to conduct developmental screenings, assessments, and how to better support parents. They recommended professional development and college courses focused on these topics through opportunities offered in their own neighborhoods, and the need to help to obtain certification preparation, both instrumental and financial, so that they themselves can become early childhood special educators and get certification. This was a way for they endorsed to increase EI referrals, evaluations, and inclusive services offered in their neighborhoods. Next. So in summary, some of the recommendations generated from the study are to support ECE providers by bringing them in the EI process, emphasizing the critical role of the EC educators and the need to engage them in the EI process from the start to finish. To support family childcare and center-based providers to embed the information and child development and EI in their program orientations and handbooks so that families can anticipate the possible need for services from the get-go. And to increase college-level courses and professional development and coaching opportunities offered to infant toddler teachers, which can then both benefit children and families, as well as strengthen teacher quality in EC settings and ensure more equity in the ECE workforce. Next. So again, we want to thank our funders, supporters, collaborators, and participants for their crucial role in helping us with our findings, making this research possible. And it's wonderful to see some of this already being implemented, so it's really terrific. Any questions?
And including Liz, who is part of this research project.
Yeah, so I did do some of the interviews and the transcribing, and it was really amazing to see how many educators didn't have some of the fundamental information that, you know, I can say for Brooklyn College's Early Childhood Center that we have, because we have so many opportunities to get workshops and such to learn more about, you know, early intervention, about children, about the brain, about all those things. And some of these other places don't have that. And so again, like with United for Brownsville, having that in the community where some of these educators don't have it, maybe they can get it from what you're providing, you know, and it's so important because it felt to me like some of them, even when in the interview, the teachers felt so like they felt that they wanted more, but they just couldn't get it and they didn't know how to get it. And so it was amazing being part of this research. So thank you for including me.
Yeah.
Thank you.
One thing we're hoping to try to do at Brooklyn is to develop a few item questionnaire to really get a sense from the early childhood providers, who's certified, who's not, who wants to, what kind of, you know, so that we can then on our end at the college level, develop some courses that we can then bring to the community that people are wanting to help them obtain their goals in this area.
I guess my question is, what do you think of all of the recommendations? And I guess it's kind of all for the entire LEICC, but what do you really think is sort of what should be the most immediate short-term goal, and what are some more further out goals that we should all be collaborating to try and do around this issue? Because I mean, I feel like for me it's, you know, potentially providing more opportunities for ECEs and early childhood development, but beyond that, what resonated throughout here is the need to help these professionals kind of feel comfortable and have these types of conversations with families, because even if an early childhood center, it does do a developmental screening, it's really, well, what happens with those results and how does that get communicated to the family and how is that received, right? And so, yes, the shared background is helpful, but still, it feels like that is still, you know, a gap. And so I'm just wondering what others think in terms of sort of, we can probably pursue 10 different projects off of this research, but I'm just wondering, you know, what do you all think might be sort of the best steps forward in some of this?
Well, I think one is already being done, which is having Brooklyn College already has implemented some of these early intervention classes into the master's program. So having, even if you're not going to be a special ed teacher, but you need to have that knowledge because you're going to come across children who may need services. So I think that has been a plus in helping that. As far as having people who are already established as teachers or directors, I don't know how, I don't know how to get this done, but I think they need to hear that there's an importance in this and that the training needs to be there. You know, there's certain trainings that, you know, are mandatory, and maybe we need to put some of these, some others that are mandatory for them that have to do with early intervention, with special ed, with different things that have to do with how to work with children, brain development, all these things, even though these people have done it in school, but maybe sometimes we need refreshers, and maybe this needs to be something that has to be a mandatory thing when, you know, we have to do our, you know, our workshops and things. That's my suggestion.
Yeah, I guess I would say, and I don't want to take time from, I would love to hear what other board members think about the best way to think about this in the short term. I think it's a great point that you make, Lydia. But I would just put out the idea out there about the sort of current, I don't know, structure of early childhood education, and that people who are getting levels of education are looking to move to you know, teach UPK or 3K or something, and not necessarily with the 0 to 3 population, where you know, the pay is going to be lower. And so thinking about some you know, and obviously this is a thing, but some sort of like education initiative that can help reach particularly people who are working with really young children, the 1 and 2-year-olds in these neighborhoods.
Right. And having that the EI providers be partnering with early childhood centers in those communities, right? And sort of helping identify and building up, right? So that then they have this joint appointment where they're an early childhood educator, and then they're, you know, providing EI for Challenge or the various, you know, programs, Up We Grow, and et cetera.
And even in there, we saw that not only Brownsville was one of those neighborhoods, but East Flatbush and Bed-Stuy, and having something like United for Flatbush, you know, United for Bed-Stuy would be great to have in those neighborhoods too, because they are lower also. And all the great work that's being done with United for Brownsville, I'm pretty sure that it'll translate to those other neighborhoods too. And then we can also use that platform to get those neighborhood daycares and everything to get more information and more knowledge. And then they can send their parents to those, to their United of whatever, to, you know, to get more information about EI.
Mm-hmm.
Yeah,
and soon you'd have the community making referrals, right? Sorry.
Well,
Go on.
yeah, I mean, I think that you know, I think that we have been thinking in this direction already. I think that also, you know, one of the things is, you know, we probably don't have enough developmental screening going on. You know, and I know that, you know, DOE does require it for their early childhood centers, which is wonderful, but not everybody is within the DOE umbrella at this time. And so I think that there's always more opportunities to sort of do developmental screening, because what we see is that developmental screening there's also a racial gap in children receiving screening, right? And so EI in many ways, you know, when there's a screening and it indicates that there's a concern, one, it's easier to talk to a family about when you've done a you know, sort of a standardized tool, you can sort of take them through that to show and sort of guide and facilitate that conversation. So one, there's not enough developmental screening probably. broadly, and two, what's the next piece, right? How do you deliver those results? I'm sure maybe we can ask Aileen to write that curriculum for us, or maybe we will ask her to help us do that at some point. But I think that, you know, those are really kind of the things that we're doing. And I think we have sort of started thinking with our early childhood colleagues at the DOE about you know, what might a training around screening, like sort of talking to families about screening results look like. And so I don't know if Jessica, you wanna talk about that or mention that at all?
Yeah, thanks. I mean, I think these findings from the study are really informing some of our plans for that training. And like I said, the focus on how to have those conversations with parents about screening results that could potentially lead to a referral for EI, but then also what are the interventions that a provider can take even prior. And so like our hope is to kind of present how screening, intervention, like general ed interventions, and EI referral are all connected and kind of part of a continuum, and giving providers concrete tools about how to go through each of those stages. And right now we're certainly going to include all current contracted programs that provide services for children birth to 3. So we really are excited about focusing on that population, who we know often is not getting the same payout as our 3 to 5 program. So we are excited for this opportunity.
And is there a way too, I'm just thinking when families are having the IFSP meetings, are there ways to encourage the early childhood educator who sees that child a lot of the time to be a part of those conversations, to sort of have them be a piece of this? Again, it's like from the start to the finish. I mean, many of them felt they identified, they would encourage the family to do it, and then they were sort of cut out, and then they didn't know, or then a provider might come in and work with a child, but would work with the child separately in a corner of a room rather than embedding, you know, how to feed the child within this, you know, feeding time or circle time or just outside door play time. So are there ways to help make that happen? So again, it's like this collaborating with the EI providers and the childcare centers, so that the teachers then are learning, right? Then they're learning and they're more effective and they're better at observing and better at identifying.
Yeah, I think that, well, one is that, you know, the IFSP, this is a very bureaucratic answer. The IFSP, the composition of the IFSP team is whoever the family says. So I think there's probably a really great opportunity when ECE providers are having those conversations with families to talk about EI, to introduce the program. They can also say, hey, you know, I can come with you to your IFSP meeting or attend by phone or something like that if you are scared of engaging with the system, right? So I think that those are certainly things that, as we think this through and potentially develop some of this training, we can definitely work on including those ideas and concepts in that process, so that, you know, so it's bi-directional, right? So EC providers can tell families, hey, this is an option for you. And then we on the EI end can also sort of reinforce that maybe when we're scheduling our meetings and stuff like that. So I think that there's a lot of opportunity here. And I think that we needed formative research like this, very deep research like this, to sort of drive us. And that's why, you know, you're seeing that we're doing more focus groups, because we need to really understand what is the lived experience, right? Because I don't know, right? And so we need the community to tell us that, and then we need to use that to partner with those communities to develop proper interventions. And so I'm excited about this, because I think that this is we need more work like this to form and shape what we need to do. Does anybody else want to add or have any final questions for Jacqueline and Karen before we move on?
Just a quick add, Lydia, you know, just to kind of in line with what everyone's saying, I think this is also an opportunity to cement, right, our early care and education staff as just that, right, educators. I think if we support that and elevate that understanding, they will be more encouraged to attend an IFSP meeting, right, to support the screening process and to feel confident along the way. And I think there's a lot to do, I think, across the sector in encouraging that message.
Thanks, Simone. And I'm so happy to hear you say that, because as the head of the Bureau of Child Care here in the city, we often feel so supported by you, especially through the last couple of years. And Simone has been such a champion for early intervention and for integration and inclusion, you know, not just for EI, but for all children with special needs. And I think it's great. So, you know, I think this is definitely a direction that we can move in together and can really consider what we need to do for our workforce to support them in this endeavor, because it's not something that they get, you know, right away. These are not necessarily foundational skills. And that's why, you know, Jacqueline's programs exist, right? Because, you know, they understood that there was a lack. And so they, you know, they're trying to in their, and they don't have a small scope. I mean, Brooklyn College, you know, they train, I don't know how many early childhood educators you put out a year. Is it over 500 in Brooklyn? So they're like huge, right? So it's important. They're sort of bucking that. But I think that, you know, on a state level, you know, there are things that are missing from requirements, like Liz was saying, you know, particularly around, you know, birth to 3, also typical and atypical, and then furthermore, sort of what do those connections look like, right? So it's like it's a big systems issue, but I think that, you know, we've definitely developed the right partnerships to try to move some of these pieces forward.
Well, and just, I mean, and hats off to all of you, because you're modeling what that is, right? Having these conversations amongst at that level, right? So that also is getting trickled down then.
We hope. Well, thank you for this presentation and for joining us today. Liz, I think we are ready to move on.
Yes. Oh, we're already at 11:45, so just keep that in mind. So next we have Patricia Gray, who is the Director of Continuing Education at Hunter College, Silverman School of Social Work. And she will be presenting on the Service Coordination Professional Development Institute update.
Hi, good morning. Just a beautiful conversation, Jackie and staff. Early intervention is just such an area that families, you know, when we talk about families and deciding, are we talking about the nuclear family or that extended family? So the part when you talked about mom had the interview, but went back to the family and talked and came back and said, that is so key, but that's another conversation. So thank you though for that. New York City BEI Parent and Service Coordinator Focus Group. He started this journey. And thanks to Jeanette and Lydia, it has been exciting. New York City BEI sponsored the Parent Service Coordinator Supervisor Focus Group back in 2020 to learn how to better engage and retain families in the New York City Early Intervention Program. The areas that they talked about were understanding the factors that influence Black families' involvement in the program, identifying the potential barriers to those referrals, and determining areas of involvement needed, right? The conversation has been consistent. The parent focus group shared that service coordinators and therapists lack collaboration and partnership with families. Parents were worried that their children would be subjected to biases by therapists and service coordinators, and that service coordinators call every other month to check in, but never ask how parents are doing or about their concerns. With the supervisory focus group, the service coordinators want to be more effective want more effective supervision. They wanted better provision of technology, and they wanted more professional development. The most trainings that they had, they focused on tasks and not about how to work with BEI families. Next slide, please. So when we did this, the Service Coordinating Professional Development Institute at Hunter with BEI, we identified these 4 trainers: Tanya Spence, Jonica Kochi, and Jackie Chasen, and myself. And we've had the pleasure of doing the best trainings this past spring. And so we on the family-centered practice, we looked at trauma-informed care, we addressed the implicit biases by using reflective practices, and the trainers, I'm telling you, they were consistent. We continued the work, and Jeanette and her staff attended every session that we held in May and June. Next slide, please. So the training schedule was this, and it was, we did Saturdays and Sundays because Lydia says we needed to do both days, right, Lydia? She says we're not doing one day, we're doing both, and we needed to have half and half. And so we did some on Sundays and some on Saturdays. And the trainers were excited, but the participants were so excited, and they attended and they were engaged. They had questions, and we were like, okay. And Jeanette, we talked about when they asked questions about the policies, we got silent and we had Jeanette talked about the policies and procedures. So it was just a nice collaboration, and they saw how we worked together, and they brought in their experiences as service coordinators or supervisors, and it was excellent. Next slide. So some of the things that we saw with the data for registration, for each workshop, when we opened up the link to everyone, we had immediate responses. Jeanette, we talked and she said, we have to close it because we had so many people that registered. And so for the first training, we had 146 participants registered. We had 123 for the second one, 107, and the numbers just got huge. And we were like, no, we can't do everyone. We had to really cut it down. And so what we saw was the service coordinators, we had 89%, 89 people attended. We had 31 service coordinator supervisor for the first training. For the engaging and retaining families, we had 71 service coordinators registered, 26 supervisors. We had some who were both, right? They wore both hats. For the connecting with families using culturally relevant service coordination, we had 57 service coordinators, 27 service coordinators supervisor, and 19 that were both. And you'll see the numbers, right? We ensure that each workshop included both, and the experience that we got back from them was just awesome. Next slide, please. On the preliminary participant data, and let me tell you, Jeanette's staff, Solange and Diana, they were on top of this data. They provided us with the data updated information at the end of each training. So we had the training on a Saturday, let's say 10 to 4. At 4:30 when we're debriefing, they had some of this information. Lydia, you have beautiful staff. So we got feedback, and they showed us the breakdown in how the participants attended by borough. We also included Miss Aileen. She came in, and her experience that she brought to the table with the work that we were doing was excellent. And so you saw that the folks we had representation from the Bronx, Brooklyn, Manhattan, Queens, Staten Island, and then some had other. And so what we had was this rich conversation at times between if you were in Manhattan versus if you were in Brooklyn versus if you were in the Bronx, and really talked about what it is that we needed to do on behalf of EI participants. Next slide, please. This area is so important because the evaluation plan for the trainings, Jeanette had us all in color codes, and we looked at how we verified the attendance, completed the pre-test prior to the trainings. At the trainings, we said we're going to close the link now, so need to make sure that you completed the pre-test. For those who completed the post-test after the training, we moved it to, at the end, we said, we're closing, please complete your post-test right now. And folks sat there and they did it after being in the training 5 hours, 6 hours, 7 hours. We looked at the completion of the evaluation training, and then we remind folks that 6 weeks later, they're going to get the final evaluation that they need to do for us. Next slide, please. So the pre-test and post-test data, as we said, we asked folks to do it. And so you saw where we had the mean scores for the pre-test. Some of them were low, but if you look, you saw that the mean score on the post-test. So prior to the trainings, yes, you had folks who had gotten great scores, because we saw where we had some participants who had 100, but you had some participants who had 40 or 30. But by the end of the training, when we looked at those post-tests, you saw where there was improvement, and that was the key for us. So folks who had gotten, we had mean scores of 80, 95, 93, and 86. And you saw where there was improvement in the lowest score. So for example, some folks who got 30 on the pre-test, they got 70s and 50s in the post. So it was awesome. Next slide, please. Like everything, we want to make sure that we're hearing from the individuals who participate in the training. And one of the trainings, connecting families with the culturally relevant service coordination, we asked, based on what you learned in the training, are there any changes you would make in working with EI families going forward? And the responses were just awesome. They said they'll use more open-ended questions and develop better dialogue with the families. They also said that they would encourage the family assessment so that the family can get the services that they need. They talked about being mindful and see how they can get their parents to stay involved in early intervention. They talked about highlighting the strength more of the parents, and that they wanted to bridge that so that the parents are not losing sight of the progress and focus only on what they need to work on. They also talked about spending more time listening, right? Listening is a skill. And if we're not listening to what our parents are saying or families are saying, then we're going to lose them. And they bridge it with, even if they're venting about the experience, that they want to have some understanding out of that venting. And so they talked about, listening and staying in tune to hearing the stories that the parents have. Next slide, please.
Pat, we got to start wrapping it up.
You want to stop? Okay, great.
No, you can continue. If you can just get it through a little fast. Thank you.
Another question that we touched was this one, and we had folks who were strongly agreeing on the answers, and they wanted to, and so we saw that we had a 96% of folks saying that they strongly agreed with the training. Next slide, please. And so our next steps, we're going to have the fall series. We did not put the dates forward yet, but we're going to do that. We're taking into consideration that we're going to do Mondays and Thursdays in October through December, and that the trainings will continue. We'll do the videos, all of that, and then we'll make sure that the discussions continue to be confidential. Next slide. Thank you. Any questions? Okay.
Thank you, Pat.
No worries. Thank you.
Okay. And now we'll be hearing from Jessica Wallenstein, Senior Director of Children with Disabilities, Birth to 5, Division of Early Childhood Education at the New York City Department of Education. She will be presenting on the New York City Department of Education Early Childhood updates.
Thanks so much. And I'll try to go through this briefly. Could you actually go back to the title slide for a second? Thank you. Before getting into the content, I also wanted to share a staff update. It is with a sad heart, although I'm very excited for me to announce that Caitlin Moore is transitioning out of the DOE for a new opportunity. So I just wanted to publicly thank her in front of this group because I know you have been hearing updates from her on our EI transition work, and she's just been instrumental in getting our early intervention transition team up and running, as well as leading so many information sessions directly for families and for EI providers. So I want to thank Caitlin for all of her hard work and wish her well and share that news with you. And with that, I'm going to actually transition to a different set of updates that are not so much focused on EI transition, but around what's happening at the DOE when it comes to early childhood and children with disabilities that is relevant to the EI community as well. So with that, let's move to the next slide. Thank you. So just to recap some of the challenges that I know this group talks about a lot, and that is really driving a lot of the work that we're planning for the next few years. One of our most critical issues is that we have a shortage of special class seats for children with the most severe disabilities. This is something that's apparent from our regional need posting that we present with the state, and I know there was an article today in the news about this issue, and it's something that we are working to address as fast as we can. Related to that issue is that we know that a very high proportion of preschool students with disabilities are recommended every year to restrictive settings. We are far below state and federal targets for serving children in inclusive settings where children with disabilities have the opportunity to learn alongside typically developing peers. This is, a historic problem. It's something that's going to take a lot of systemic undoing, and some of the initiatives I'm talking about today are really attacking that. We also believe that if we do better in this area and we reduce inappropriate referrals to special class, then our shortage of special class seats will be less of an issue, obviously. So those two challenges are really paired together. We also are aware that this problem is disproportionately affecting boys and Black children and Latinx children, who we see disproportionately in restrictive settings, even though they are not disproportionately receiving IEPs. And we know that these problems are connected to a systemic issue where we have a fragmented system where state-approved non-public programs are not currently part of 3K and pre-K. And so we know that this impacts the supports that they receive, as well as their finances, which are in a very challenging state. And we want to think about ways and we are thinking about ways that we can support there. And this relates to a state corrective action that I know you are all aware of, where we are out of compliance for 4 key areas, including provision of service and LRE, least restrictive environment in preschool. So with that backdrop, I now want to turn to some more positive news in the coming slides. To the next slide, please. Thank you. So thanks to a lot of advocacy from many of you who are listening today and who are on this panel, I'm so pleased to share that a long-fought battle to receive funding for preschool special education was won. In the city executive budget, we are slated to receive a substantial amount of funds to stand up 6 new initiatives. The first one I'm going to talk about is by far our most momentous. We are looking to bring all non-public special education preschool programs into 3K and pre-K. And we are planning on doing this by issuing a contract enhancement. This contract enhancement will layer on top of programs-based contracts. And through this enhancement, we are going to be able to provide additional funding directly from the city to programs that they can use to pay their teachers more. And our hope is that this will help them stabilize and be able to recruit and retain teachers and add more classes and add more special class seats. We have a goal of adding up to 800 special class seats over the next few years. This will also bring these programs into 3K and pre-K. So they will receive all the programmatic supports that all current programs in our portfolio do. In order to do this, we need to go through a solicitation and procurement process. So that means writing a solicitation, releasing it, receiving responses, making awards, getting contracts registered with the comptroller's office, going in front of the panel for education policy. So it's a long lead time to enable the DOE to provide these additional funds. So most of this will happen in fiscal year 23, and this currently is a planning year. I'm sure there's a lot of questions about that. If we have time, I'll answer some, but I know we'll be talking about this in subsequent meetings as this initiative unfolds. And I'll run through the other ones a little bit faster. Another change that we're excited to make is we are going to centralize enrollment for preschool special education into the Office of Student Enrollment. So currently, CPSCs regionally make placements for children who need a special class or a special class in an integrated setting. We are going to transition that function to our central Office of Student Enrollment that handles enrollments for all of 3K and pre-K. So this is in line with bringing preschool special education programs into the broader early ed realm, so that when families are going through these processes, it doesn't feel so separate if your child has a disability. There's a lot that we're going to work out in terms of what this will look like, because we know these placements still need to be individualized, but our goals are to make the process more efficient, get families and children seats faster, and remove any unintentional bias that might exist in the current system that's done regionally. Okay, we can move to the next slide. The next 4 initiatives are more squarely focused on that second issue I spoke to about having so many children in separate settings. We're really working to bolster inclusion, birth to 5. And so one of the ways that we're doing this is we're going to add more integrated programs into 3K and pre-K. We do have quite a few mixed age SCIS, but now that 3K is going citywide, we're going to add 3s only SCIS programs. Also, as we anticipate more students with disabilities attending general education programs with services, we need to make sure that those programs are ready to welcome those students and support them. So we're so excited that we're going to be launching a borough-based team of coaches and professional development leaders who are going to go directly into programs and train them on pre-referral and inclusion strategies, as well as help them when they have challenging cases where they are struggling to serve a student with disabilities. This team will sweep in and provide support there. We are in the early stages of planning for that, but we are hoping to hire soon. And once we're closer to posting positions, I will definitely look to this community to circulate those around and send good candidates our way. And then we are very excited that we got funding to add staff to our EI transition team. We're going to be bringing on 5 more folks so that we can reach more families and really basically double the size of that team, and so double our reach. We're very excited about that. We'll definitely be asking for referrals for candidates for those positions as well. And then the Special Education Office received funding to add staff to CPSCs. So we'll be bringing on additional administrators, community coordinators, and operations staff. We're very excited that this, as well as centralizing enrollment, will free up CPSC's capacity to really do intensive work with families around high quality IEP development, as well as talking to families about LRE and inclusion. So this is very much in line with our push towards inclusion at the DOE. So I'm going to stop there, but there's one thing that I forgot to mention about the contract enhancement I want to plug for the 4410 providers that are listening. We did release a survey to all 4410 providers asking some basic information that will inform our planning. And that survey closes tomorrow, Friday. So just want to remind everyone, please complete the survey. It will help us so much as we are figuring out our plans for the solicitation. Okay, thanks all. I'll open up to questions if we have time for questions. I defer to you, Lydia.
We don't have any public comment, Liz, right, Aracelis? Just keep me honest. We don't have any public comment, right, Aracelis?
Yes, no public comment.
Great. So so anybody wants to ask a question or two, I don't want to keep you too much over, but I thought that this would be a good opportunity for the panel to ask 1 or 2 questions of Jessica.
I hope it's okay if I just quickly compliment DOE for all of their, hard work. Having worked at the DOE, I know a lot of the work that the CSEs and the CPSCs do is behind the scenes. Some of it's thankless, a lot of it's mandated by state law. So the fact that they're able to make all of these, phenomenal enhancements to, streamline things, I think will bode very, very well. So thank you so much.
Thanks so much for saying that. It's intimidating how much we have on our
Yes,
plate,
thank you.
but we're excited.
No one else?
I guess there's no one else. I just want to say, personally, to thank Jessica, because she has been such a champion of all of this. And I know with a lot of other people within the DOE and broadly in the city, and I think that a lot of this is directly related to you really listening to all of the communities. And there's so many stakeholders, and just, so I want to compliment you on that, and also for being here and in this space. And sometimes it's, it's difficult as a government person sitting in all of these spaces. And I think, so I commend you for that. Yeah.
Thank you so much, Lydia. And Lydia has been instrumental in all of this, and I'm so excited that we'll continue working together on all of these pieces.
Great. So we'll now have our committee reports. Does the Academic Preparation and Professional Development Subcommittee have anything to report?
Yeah, so that's me, right? Yeah. Okay, great. So just to report out, so the New York State Early Intervention Coordinating Council approved the 5 competencies for early intervention program on March 23rd of this year. These competencies will be used to guide and evaluate our graduate programs that train future EI professionals and accrediting organizations that provide professional developmental trainings. And the academic partners are currently working on the New York State DOH companion document that will identify and describe the knowledge areas and skills needed for each of the components. That's our update.
Thank you, Jacqueline. Okay.
Thank you.
Now that we do not have any public comments, so our meeting is adjourned. And thank you, everyone. This was such a great meeting, and I hope that you stay safe and enjoy this nice weather. Thank you.
Thank you.
Thank you.
Have a great day.
Have a good
Bye,
day,
everyone.
Thank you, everyone. Be well. Bye-bye.